press on and we'll leave the discussion to the end. The next speaker is Virginia Murray, who started out life as a doctor who was a specialist in toxicology and an advisor on how to deal with the risks associated with large toxicological chemical incidents. But since 2011, she's been head of the Extreme Events and Health Protection Agent at the Health Protection Agency, and she's a visiting Professor of Health Protection at King's and at University College London. Without further ado, Virginia, please.
Thank you very much for asking me here. I don't often come and talk to mathematicians. I always think you're rather clever. So forgive me if I don't get the right level, but it's such an opportunity because I have a request to make. And I hope you'll enjoy the challenge. Now, I knew nothing about mathematics of planet Earth until I went and looked at your website. What an incredibly exciting opportunity this is. I so congratulate you for pulling all these ideas together and having the opportunity for us to work with you to try and build better knowledge. To me, to encourage research on questions that are fundamental to planet Earth are absolutely key. Encouraging educators and informing the public are what public health is about. Public health is sharing the best of the information we can in a timely and appropriate way. So hopefully by working with you, we'll be able to do this. I'm going to say a little bit about who the Health Protection Agency is and what we do. I'm going to give you a couple of quick examples, and then I'm going to take you on this exciting voyage that we've been on, including explaining what SREX is, because you might think it's actually another way of putting sex down, but it's not. And then I'm going to take you to UN instruments and give you some challenges. So, the Health Protection Agency, our task is to deal with a multitude of threats. It's our daily work. It's our bread and butter. It's how we respond to all these types of events that helps you to be well, to minimize the risk of influenza, to minimize the risk of measles, all these different things, but also to deal with toxicological effects. So our job is to reduce key infections, minimize the health impact of environmental hazards, including radiation, chemicals, poisonings, but also to deal with things like flooding. So just to show you how we work, this is infectious diseases. We coordinate and investigate outbreak control. We have laboratory services, we advise government, and we respond to international health alerts. And we do the same thing for radiation and for chemicals. And now you have this new kid on the block who's almost 2 years old, the Extreme Events team. And it's been such an exciting voyage trying to make this work. If you're interested, please visit our website, have a look, talk to us. We have all sorts of exciting things. You can even get a daily bulletin if you want about the extreme events that are happening around the world. Just sign up. It's free for all. So what do? Well, we provide a focal point, a one-stop shop in some ways, although we work with many, to provide evidence-based, i.e. really rigorous science, as far as we possibly can, to provide health protection advice, planning, response, recovery to extreme weather events and other natural hazards at a local, national and international level. And this is some of the shopping list of what we're meant to do. We're quite a small team. This is why we work in partnership. So it's an incredible voyage. Anything you're not quite sure of later, you can ask me a question on. I'm sure there's something there that might surprise you. Okay, so volcanoes. Yes, there was a little problem with some ash, wasn't there? 2010, few aeroplanes didn't fly. But heat wave we know a lot about, but I'm not going to take you into the heat wave story, even though it was one of our big drivers. What I will show you is cold, which is one of our very big killers, and we've never done much about it to try and improve it. And I'll share with you some of the issues of floods. So those are my two examples I'm going to show you. The most important thing is to say that the UK is not a saint. Look how poorly we deal with mortality. Finland, Germany, Netherlands, Denmark, Luxembourg, Belgium, France, Austria, Italy, Greece, and then it's the UK. They do better than us. And yet we always know it's going to be cold. Isn't it time we did more? So last year, in 2011, we launched our first cold weather plan. A wonderful plan, which has now been relaunched again. In my view, it's wonderful, partly because I got involved in it, of course. We've just relaunched our 2012 cold weather plan when we've learnt a lot from last year's plan. The whole purpose of the plan is to try and get people get people really ready for the weather and plan for it and understand. We've got some students here. How cold do you think it was last week on this levels? Did you hear about it? Did you see the television? Did you see a message? What level did we get to? Were we at level 1 for long-term planning or particular winter planning? Were we at level 2? Severe weather is forecast. Were we at level 3 responding to severe weather, or were we at level 4 where it's a major incident? Anybody get cold last week? Or are you all very sheltered in Cambridge? What cold? What temperature did we get to? What level do you think we got to? 3! Hooray! Somebody watched the news. Congratulations. We were at level 3, particularly in the north of England, where it was really cold, but it was cold across the country. So we really wanted you to be ready to respond to cold weather. And that's our job, and we put out cold weather alerts. We've made sure you had the information and the advice, and it goes to individuals. There's fact sheets for individuals. So if you ever want to think about what you need to do, have a look at our fact sheets. Anybody know where this is? Yes, what's odd about Tewkesbury like this? Yes, it's flooded. I don't think it was meant to be an island, do you? No, it's not meant to be an island, is it? Poor Tewkesbury. Poor Tewkesbury's had such a bad time with flooding. But what does it also show you? Somebody knew how to build safely. Who was that? I think it was the monks. They did rather well. I don't think we do quite so well now. We insist on building on the floodplain, and there are quite a few people who in Cambridge live either on the floodplain or at risk of being flooded. So this is not exclusive to Tewkesbury, it also applies to you. But you may remember we had terrible floods in 2007 in 2 waves of rain, that precipitation that Julian was talking about. Really key, very frightening, very shocking, and finally went to Cobra, our Cabinet Office briefing rooms, and we were very much involved in trying to deal with it. And then of course you'd have the next thing, which is a public inquiry. How well did we do? And that's always important because we learn many lessons from that, and there's a lot of work that we've been doing since then on all sorts of bits of it. So we now have a very good flooding system on our website. It could be better, we will do better because we have many plans. But just to show you the sort of information we have general information following floods. We have information to clean up safely following floods. But also because of the 2007 floods, we told you how to cope without mains water, which we were really shocked because a lot of the water treatment works, of course, are in the floodplain because it's near the water. Not surprising. But one of the consequences of many of these extreme events that Howard talked about is the mental health impacts. People often forget the effort to recover, the effort to get back to normal, the effort to even get kids to school through bad weather is huge. And these consequences are really worrying. So we have this type of information on our website too. But we don't just do this in isolation. We look across Europe. So we work very closely with our partners in the World Health Organization for Europe. But I wanted to take you to that little place. What's that country? Everybody got that one? I heard one squeak from you. I haven't heard anything from the back. Can you see? No, which country is it? That little yellow one there.
Oh, right.
What's that? Holland. Okay, what's so clear about it?
It's the most likely to be flooded.
It's the lowest land. 50% of them live below sea level. This covers the dates from 2000 to 2011. What is remarkable about them?
They don't get flooded.
They don't get flooded because they invest heavily in protecting their population. Possibly a slightly smaller country, but fewer people. But they invest in it. Look at old UK. We're a bit damp, aren't we? We never seem to plan for it adequately, although we do invest a huge amount, and the Environment Agency and DEFRA are doing a massive amount on it. I just thought you'd quite like to see that map. I think it's quite illuminating. But it's not just these maps that matter. It's what we're trying to do across the world. Now, Julian was a bit tough about the Intergovernmental Panel on Climate Change. Have you all heard of it? All right. Be like that. Have you heard of it? You have now. Oh, now. Should I explain it? Okay, it's an incredible group, mostly of volunteers, of scientists who volunteer to work across the world to try and bring together the best of the academic knowledge we possibly can. It's funded in part, by WMO and UNEP, but a lot of it is done in a voluntary way. And when they produced this report in 2007, they said that the area that they were short on was information on extreme events, that bit that Howard has been talking about. They won the Nobel Peace Prize for that, with Al Gore. That's pretty good. And they have a fund set up for youngsters to go to the meetings. So we set up this new project called Managing the Risks of Extreme Events and Disasters to Advance Climate Change Adaptation. So that's what SREC stands for. And I think it's a great acronym. And what we had to do was to work for 2.5 years, rigorous writing, open review, 87 coordinating lead authors. Oh, how many of them were health, do you think? 5. Spot on. Okay. I gave my game away. Thanks. You can read. That's okay. Not many health. This is the summary for policymakers, which over 100 countries went through line by line. If you've never done an experience like that, it's quite shocking. And it was finally approved in November 2011. This is the published version, which Cambridge University Press has published for us. So it's your own university press that's done the work with us. There are 4 main areas, one looking at climate change, one looking at managing the risks, another looking towards a sustainable and resilient future, and the case studies. And I am the first author of the case studies. I think this photograph tells a lot. It really shows the problem of people who have to try and live in very difficult circumstances. Whether it tells the whole story or not, I don't know, so let me take you through some of the work. We're interested in extreme weather and climate, that's floods, wildfires, drought, hurricanes, cyclones, tornadoes. We've put together the nature and severity of the event with the vulnerability and the exposure to build Venns, which show you at the heart of it the disaster risk. We've already talked a little bit about the problems of natural variability. Here. We know the climate will change, but we know we've got anthropogenic climate change coming too. But this is where we can really do a lot. Development with disaster risk management and climate change adaptation. And if we have a disaster, we know the route that we can follow to try and deal with the disasters and maybe influence more the greenhouse gas emissions. Now, I'm a medical doctor, I'm not a climate expert. But to do this is really key. Because this is what our climatologists tell us, who were part of this group. Yes, it's a map. Yes, it doesn't mean much, so let me try and explain it, as they taught me. Each country was divided, each region, into all these different regions, of which there were 26. The work was done for each of these. Each of these boxes then related to the scenarios that have been pre-agreed. This one is when we do well, which Julian really wanted us to do, but this is what he's worried about. What we're telling you for approximately 2050 and approximately 2100, that the nearer you are to the horizontal line, the more frequent hot days you will have in each country. And the hot days are the really hot days. They're the heat wave days. So let's look at that map again. Think about Australia. Anybody in Australia, an Australian here? What do you think about that?
Beach days?
Beach days, okay. Right. No food days. Don't bother to grow anything. Fine, no problem. Beach days, it's going to be. All right. Is that beach days? So where in the world would you like to live? Nowhere. We do need to live. But you just need to see how difficult it's going to be. And I know it's a projection, and it may not be accurate, but to me, it's the best science that we were able to pull together. Because the consequence with heat waves is that people become very ill. We have an excess number of deaths with a lack of cooling, with age, pre-existing health problems, poverty, isolation, and infrastructure. In France, they had over 14,000 who died in 2003. But when we came to 2006, we could show that they could produce planning to reduce those impacts. So cooling of public places, warning systems, social care networks, urban green space, and changes in urban infrastructure, just as Julian described in Hong Kong, are going to be difficult to do, but we probably have to do it. And that requires you and me doing it, because we all live in the same world. Rain is not so clear, but it looks as if the equator will stay wet. That's quite encouraging. But it also looks as if there are going to be more risks of drought if you look at some of the other data too. So let's start with flooding. Flash flooding is really difficult, very hard to handle, particularly in the very vulnerable areas such as the mega cities, the mega delta cities, where there's a lot of informal settlements. Really frightening. But there, we do need those early warning systems so badly to inform in good time. And droughts. They're happening, we know about them, they're harder to, we know a drought when it's happened, but we don't always warn of a drought adequately. But we certainly need more sustainable farming practice, drought-resilient crops, and drought forecasting. Another case study, which because of the Canadians being involved in this particular project, I've included for you here, is the one about the permafrost. It's going. It's really going. In some places in northern Canada, they're even putting pavements down as if they were reflective to try and stop the sun melting the land. And it's not making much of a difference. I think that's really shocking. If we don't do this, we're going to have huge problems. We will not have effective livelihoods. So there's real risks of what we can do. So let's turn to the most recent report that's come out. This came out from Professor Sir John Beddington's Government Office for Science team, literally less than 2 weeks ago. Reducing risks of future disasters. But here is a really important point. Priorities for decision makers. Because decision makers are going to have to make the decisions. So why was this report commissioned? Because of the real concern that there's an increasing frequency of extreme weather events due to climate change, and there's a large population which is growing. And for decision makers to choose to deploy resources to reduce these risks present real challenges. How do you invest in better flood barriers? How do you invest in hospitals that won't get so hot? How do you deal with cold? So some of the conclusions are that with more people at risk than ever from natural hazards and the prospect increasing over the next 30 years, the future challenges are considerable. Science has a potential to play a key role in this. But actually, international policy developments were seen to be really, really important, and how we can use these. So let me take you to my favourite, but probably not very well known, sadly. How many of you heard of the Hyogo Framework for Action? Anybody? One. Prizes. I promised you a prize. This is the UN Instrument on Disasters. It runs to 2015, from 2005 to 2015. It's building the resilience of nations and communities to disasters. It has 5 main points. The first is governance, making disaster risk reduction a priority. In this country, we have the Civil Contingencies Act, a wonderful act that makes us all work together on disaster risk reduction, I believe. Then we have risk identification, assessment, monitoring, and early warning. We're improving our early warning systems wherever we can and working together now with the Natural Hazards Partnership, which we hope will be much more public soon. Knowledge management and education. How do we share this information? How do we get you, your families, your friends, to understand what these risks are and to be aware and understand this? Reducing underlying risk factors. Well, as a doctor and one who's worked in London and at hospitals like Guy's and St Thomas's, I know they sit in the floodplain. The risks to patients are appalling. And the staff themselves. We have real issues there. And then finally, the fifth is be prepared and ready. That's the last point when we actually can act. Now, terminology is always difficult. I have a definition for disasters which sits on the website if you want it. And it's something that's very useful and does, for me, include loss of life and injury and disease and other negative effects on physical, mental and social well-being. But actually it applies to everyone, I think. Now, with all UN instruments, it's absolutely key to do a midterm review. And I was very fortunate to be part of this midterm review, which is published on the website, and we have a statement which you can't read, so I've blown it up. And I'm just going to read it to you because this was the outcome of the piece of work I did with my teams. Much of the existing operational research related to emergencies and disasters lacks consistency, is of poor reliability and validity, and is of limited use for establishing baselines, defining standards, making comparisons or tracking trends. I am horrified we had to write this. It's really worrying. Maybe mathematicians might be able to help us. A challenge. Who is part of this? Well, we have these incredible global platform meetings where everybody comes. They sit behind their flags. And if they want to ask a question, they raise their flag. It's really exciting. People really do this for real. And when you're moderating it, it's simply terrifying, but that's fine. So who's this man? Ban Ki-moon. He minds about disasters very much. And he has provided us with huge support for this initiative. So, for these great meetings, you have a 4-page summary. Can you imagine the UN only producing 4 pages after 3.5 days of intense work? Well, if you have one statement like this, actively engage and support scientific and technical communities to inform decision making, that one line says it all. So that's another reason why I'm here, because I need your help. We have a very clear timeline to this 2015 new instrument, the new great instrument we're going to have, the one that will tell us how to work better in the future, the one that we can implement and get science much more involved with. And we're now heading towards 2013 and the next global platform. Maybe mathematics for planet Earth might want to be there too, if this is an area of concern that you're involved in. But to do this, we have huge networks around the world, trying to build the evidence, trying to build the knowledge, trying to build the sharing for disaster risk reduction and to build a better instrument. You'll notice there's a little advisory group here. You might even know one of the people who's on it. What a huge honour, but I need your help. I can't do this alone. Representing health and quite a lot of science, we need help. So, here are my challenges. We need to reduce the impacts from current and future disaster risk to minimise potential health, because I'm a doctor, and other impacts. Might mathematics for planet Earth 2013 and your member institutions wish to contribute to this work? So my 2 challenges are these. Can we count disasters more effectively? Is there a way that you could use your mathematical skills to help us? Is there some way where you can just count these things better? Document them better, learn from them better, take it through to when people have recovered from the mental health impacts and they have the buildings again and they can live their normal lives safely and well. And is there a forward look we might want to see? Is there any way we can try and use IPCC SREX and these other tools to try and see if we can do more on understanding what the risks might be for the next 40 years? Thank you.